I am starting the timer, and here is the question. So if you read and understood,
Yes.
kindly tell me, what do you see?
This is the posterior surface at the knee joint, and that is it
Okay.
is the popliteal fossa. It's written right popliteal fossa.
Yes. So can you please identify 11 on picture A?
11. Okay, this 11 is pixel. That is a semitendinosus
Very good.
muscle.
Okay. Can you
Yeah.
tell me the origin and insertion of this muscle?
Semitendinosus muscle originates from the ischial tuberosity.
Yes.
I think ischial tuberosity above, and it inserts over the medial condyle of the tibia.
Okay.
Anteromedially.
Can you please identify number 12 here in picture A?
Number 12 is semimembranosus.
Okay, good. And number 1? Sorry, 1.
Where is number 1? Yeah. This is the biceps femoris on the lateral side.
What is the
Yes.
nerve supply of this muscle?
Biceps femoris is supplied by tibial component of femoral nerve. Tibial component of sciatic nerve.
It
Sciatic nerve.
has two
Yes.
parts. Okay.
Two
So
part
both are
It has
supplied.
two parts
Yes.
actually. Long head supplied by tibial component and short head supplied by common peroneal
Yes.
component of
Can
sciatic
you
nerve.
can you
Yes.
identify number 15, please?
Number 15 is the uh, tibial nerve. Yes.
Very good. What is number 2?
Number 2 is common peroneal nerve.
All right, good. Can you tell me the boundaries of popliteal fossa?
Popliteal fossa bounded superomedially by semimembranosus and semitendinosus muscles, superolaterally by
Yes.
the biceps femoris, inferomedially by medial head of gastrocnemius, and
Very good.
infralaterally by the lateral head of
Can you
gastrocnemius
tell
muscle.
me the contents of popliteal fossa from superficial to deep?
Popliteal fossa from superficial to deep. If you we go from superficial to deep, it starts with common peroneal nerve, followed by tibial nerve, then peroneal, popliteal vein, then popliteal artery, and deepest is the lymph node.
If there's a lump in the popliteal fossa, what would be your differential diagnosis?
We start with first it can be Baker's cyst, it can be aneurysm of the popliteal artery, or varicosities of the vein, or it can be schwannoma, it can be lipoma, it
All
can
right.
be even hematoma, or
Can you tell
meniscal
me, yes,
cyst. Yes.
how
Yes.
many groups of bursa or bursies are there present around the knee joint?
Bursa, yeah. And there are supra-patellar bursa, pre-patellar bursa, inferior patellar bursa, infrapatellar bursa, then anserine bursa.
Okay. All right. Okay. Can you tell me how would you identify if it's a difference between a bursitis, and if it's popliteal artery aneurysm?
In popliteal artery aneurysm, there will be pulsation will be felt, while in bursitis
Yes,
there will
good.
not be any pulsation.
And there could be inflammation, so warmth will be there. Okay, can you tell me
Yes.
what type of joint is the knee joint?
Knee joint is a synovial type of saddle joint.
Okay,
Hinge.
how is it
Hinge.
hinge type of
Sorry. It's
hinge?
no. It's a hinge joint. It's
Yes,
not saddle. It's a hinge joint.
yes,
Synovial hinge joint.
yes.
Sorry.
So can you tell
Yeah.
me what are the bones or what are the components of knee joint? Or what are the bones form the knee joint?
Knee joint is formed superiorly by the femoral condyle, medial and lateral femoral condyle. There are two components of the knee joint. One is patellofemoral joint, another is tibiofemoral joint.
Good.
Patellofemoral joint is between the articular surface of patella and the femur, articular surface of femur, and the tibiofemoral joint between the condyle of femur and the condyle of tibia.
Okay. In between the knee joint, there is presence of a cartilage. What type of cartilage is that?
It's articular cartilage or
Is it vascular?
no, it's avascular cartilage.
What are the stabilizing factors for the knee joint?
There are stabilizing factor of knee joint are muscles and
Yes.
ligaments.
Yes.
Muscles
And
contains the quadriceps tendon, then patellar tendon, and the ligaments are anterior cruciate ligament, posterior cruciate
yes.
ligament, then medial collateral ligament, then lateral collateral ligament, then there is iliotibial tract, the terminal part of iliotibial
Yes.
tract.
Okay.
And yes.
What is the function of menisci in the knee joint? Do they contribute to the stability of the knee joint or not?
Menisci's main function is to give the cushioning to the knee joint.
Yes. Yes.
The weight of the body passes through the knee joint, so its main function is to cushioning the knee joint. But there are certain ligaments which is attached to this menisci, especially medial meniscus, attached to that. And during the
What
movement,
are the movements? Yes, sorry, I have to interrupt. What are the
yeah,
movements which are present at the knee joint?
at the knee joint, mainly there is extension and flexion.
Yes, and okay,
And
all right. What is the dermatome of the knee joint? Which nerve supplies the knee joint?
dermatome of knee joint is L3.
Okay, which is supplied by which nerve?
Dermatome of knee joint is supplied by, I think, sorry, I forgot this.
Okay, if there is an injury on the lateral side of the knee joint, which nerve or which structure is most likely to be injured?
Lateral side of the knee.
Yes.
On the lateral side of the knee joint, so it is the common peroneal nerve, which is most commonly
Yes.
vulnerable for the injury.
The injury of the common peroneal nerve causes what, please? Bell has gone, but
Injury of the common peroneal nerve clinically presents as foot drop.
okay. Good.
Where it's loss of sensation.
Yes. Good. Right. What more I could have asked? Yes. If there is a dislocation of knee joint, it is more unstable in which position, or how it becomes more unstable?
You mean in
maybe I don't know your orthopedician,
Okay,
but I
okay.
think
No, no.
maybe in
Okay,
dashboard
okay.
injuries,
Yeah,
because
yeah.
there's
Actually, yeah.
yes, there's
In flexion position, the in flexed position of the knee joint, they are more
yes,
unstable, more prone to dislocation in case of injury, like in dashboard
yes,
injury. Yes. Yeah.
yeah, yeah. This is what
Because
I
in
think. Okay.
extension and partially flexed position, this iliotibial tract gives more stability to the this knee joint
Yes,
than in fully flexed position. Yeah.
yes, right. Who would give feedback? It was good, Dr. Suman, but like, for these stations, you have to read little extra as well. I did tell you
Yeah,
it
yeah,
will
I
be
think,
popliteal
yeah,
fossa, but you didn't realize there could be more to it as well.
yeah,
Yes,
I
they're
know.
writing something. Yes. So this is good. Revision got foot drop.
What
All
about
right.
that question? This,
Which
I
one?
forget this. Uh, Nerve which supplies
Yes, please.
subcutaneous cutaneous nerve to the knee and
Please
not
tell
the joint.
Dr. Mohammed kindly take
Dr.
it.
Abhishek,
Can you please repeat the question, ma'am?
Yes, dermatome of the knee joint. Which nerve supplies knee
dermatome
joint?
of the knee. Yeah.
Which nerve supplies the knee joint?
No, knee joint is supplied by a different nerve, but I'm talking about the dermatome.
Dermatome,
Joint,
okay.
L3. L3.
no, that is
Yes,
the root, nerve root. Any particular nerve, I
No, no.
cannot
yes,
Like
remember.
you
That's
have to
why.
say according to the dermatome or myotome, right? Or the
Yeah,
subcutaneous.
yes,
There is
yeah.
the
No,
nerve is
dermatome
different.
is
Like in the
L3.
front side from the femoral nerve, in the back side from the cutaneous supply, that may be from the
Yeah, yeah.
tibial nerve or common
So there
peroneal
were
nerve,
two
something
Cutaneous,
like.
questions. Yes,
Yeah.
there were
yeah,
two questions. I asked him the nerve supply. When I realized he doesn't know, then I asked him the
Yeah,
dermatome. So, yeah,
L3.
yeah,
yeah.
that he
no,
knew.
Ma'am, can
dermatome
you
But
is
please
like,
show the
L3. Yeah.
picture?
yes,
Show the
go
picture again.
back to the, yes, oops, yes.
Dr.
So
Suman,
identify,
actually the
Yes.
number 11 is semimembranosus and number 12 is semitendinosus.
No, no, no.
what has he
Which
said?
Yeah,
is more
this is
posterior. And the semi-tendinosus lies over the semi-membranosus.
Yes, here it is lying over the, like on the both side there is
Okay,
number
okay,
11,
okay.
right?
Sorry. Yeah.
Yes,
You are right.
correct.
You are
Semimembranosus
right.
is 11 and semitendinosus is 12.
Yeah,
And
actually, my
yeah,
screen is short, so I
no problem,
like
brother.
opposite. Yeah.
That's okay. But
12
like,
is
if you have
12
taken
more
this from
posterior.
the
That is,
notes,
yeah. I understood. Yeah.
yeah,
And the
it's
Yeah.
insertion
page
of the tendinosus on the
330.
medial side of the medial side of the upper part of the tibia, and the semimembranosus is the posterior surface of the medial condyle of the tibia. That is the two difference.
Yeah. Semitendinosus, gracilis, and sartorius together
Yes,
inserts at the point that is called anserine, face
that's, yeah,
anserinus. Yeah,
face
face
anserinus or
anserinus.
good something like that.
Yeah.
Yeah.
Yeah. Face
And
yeah,
you
anserinus.
said number one, you can directly say it is the short head of the biceps and it's supplied by the common peroneal nerve, that's it. And other than that, everything was almost good.
Good, yeah.
Excellent.
Yeah. Short-headed biceps. Yes.
What is 14? Can you see
Can
14 here?
you can you bring
How
the
is 14?
cursor?
Yes,
14 is
Cursor.
the
yes,
neural nerve.
here.
Yeah.
Yes,
14 is the
yes. Sural.
sural nerve.
Yes.
yeah. Sure,
Sural
nerve.
nerve. Yeah.
And it supplies, it's a cutaneous nerve, so it supplies the
Yeah.
cutaneous.
Supplies on the posterolateral aspect
Yes,
of the
Posterolateral aspect of
leg
the nerve. Yeah.
and lateral aspect of foot.
Yeah.
Lateral
yes.
edge of foot actually.
Right, good.
Yeah.
That's good. Yes, any more
I
questions we can add?
I was just want to know will they ask anything about the ligament, especially the
They can ask
anterior
you,
cruciate
yes,
ligament?
to how would you palpate the popliteal pulse?
No, okay. Uh, I think doing the 30-degree flexion
Yes,
Yes.
of the
yes,
joint and pressing with both index fingers and middle finger against the means from posteriorly we can palpate it.
yes. with both hands.
With both hands, yes.
Good. Right. Any more question we could ask, or one can ask when it comes
Yeah,
to
please.
knee joint?
Nerve supply of knee
Yes,
joint.
Dr. Ma. Yes.
Yeah, the main nerve supply of the knee joint receive nerve many branches from
Yes.
femoral nerve, obturator
Femoral.
nerve, and the common peroneal nerve.
Even tibial nerve also gives one branch to knee joint.
Yes.
Yeah, and also the main blood supply of the knee joint receive blood from anastomosis around the knee, mainly from the genicular branches of the popliteal artery.
Yes.
And if we keep the Hilton law in mind, so there are a lot of nerves which supply the knee joint. So
Yes.
collectively, we can name all of them.
True.
Yeah.
True.
And you asked about the one thing, ma'am, like about the ligaments, if it contains any vascular or something like that.
Yes.
Like all the
Cartilage.
ligaments are avascular, articular cartilage also, but
Yes.
the meniscus
Yes.
contains the middle geniculate artery, right?
Yeah, menisci contains from, if you go from outside inwards,
Yeah.
it is outside is more vascular, and while you go inside, it is comparatively
Becomes
going
less
to be less
comparatively.
vascular.
Yes.
Yes,
Yes.
Okay. Yeah, that's it.
it's like
That is responsible for hematoma after meniscal injury, right?
yeah, hematoma and yes.
Yeah.
Yeah.
Good.
Yeah.
Yes. Should we move on?